Receiving a diagnosis of metastatic breast cancer is scary. No doubt patients will want to start treatment immediately upon hearing this. But it's very critical. There will be a time from when the news is delivered to when you are able to start therapy. Often that is because some additional testing is necessary, and those test results can be critical in terms of determining which treatment plan will be best for you, best to manage the cancer and align with your goals for treatment. Typically, that diagnosis is made by a biopsy of an area of metastasis. That biopsy provides very critical information that will allow your oncologist and your care team to develop a care plan and treatment plan that matches the characteristics of the tumor. So there may be other tests that are needed. Often we will have patients undergo CT scans of the body so we understand where the cancer is. That also allows us to have really a baseline so that once we begin treatment, after several cycles of therapy, we will then repeat those scans to assess whether or not the treatment is effective. For metastatic breast cancer, there are several types of medications and cancer-directed therapies that we can use. Those treatments are often selected based on the characteristics of your cancer. These can include chemotherapy, anti-estrogen therapies, anti-HER2 therapies, as well as immunotherapy. We are using medications to help engage your own immune system to fight the cancer. Side effects of these different therapies can vary. This is where it's really important for you to be sharing what you're experiencing with your care team so that they can assist and help provide you with different, whether it's medications or other things that you can utilize to help make the side effects of treatment not as burdensome. So some of those side effects might be things like fatigue, it might be nausea, but it's just important to be communicating those side effects, what you're experiencing with your care team so they can help with management. So in order to effectively communicate the side effects and other symptoms that you're experiencing, one of the best ways to do that is to be able to track your symptoms, and especially when you're at home experiencing these side effects after your treatment sessions and before you're due back for your next visit. It's sometimes hard to remember what all transpired in the 2 to 4 weeks in between your treatments. And so while you're at home, just journaling, whether it's with a pen and paper, whether it's digital, online, or electronic journaling, and just writing down what you're experiencing on the day-to-day. If you needed to take any of your medications to help manage the side effects, just journaling that as well. Then bringing that information forward at your next visit, that really helps your care team to understand what you have experienced since your last treatment, and then we can make adjustments, whether it is to your actual treatment regimen or whether it's for the medications or other measures that we take to help manage those side effects. One of the best ways to do this is to be active. I always say if I could prescribe exercise and physical activity, I would, because there are many research studies that have shown that being physically active will help to improve your quality of life, help to increase your energy levels while you're receiving cancer treatment, help to improve your sleep quality. It also helps to reduce some of the anxiety or depression symptoms that people can experience as well. So staying physically active is very important, and it doesn't mean you need to be CrossFit training. We're just talking about taking a brisk walk, aiming for up to 20 to 30 minutes a day for approximately 5 days out of the week. Many people often ask questions as well about diet. Is there any special diet that I should be following? The most important thing is to be tailoring your diet to what helps you feel good. We often will recommend not a specific diet. There certainly is no need to be eliminating all dairy products or eliminating specific foods. It's really everything in moderation. We encourage more whole foods, less processed foods, shop the perimeter of the grocery store, not the aisles, is what I like to say. But really focusing on fruits and vegetables, things that make you feel good. One other recommendation that I have is talk to your oncologist, your care team, if you are interested in taking any supplements or vitamins. While often people want to take these because they feel it will help them feel better, boost their immune system, there is the possibility that they may have interactions with your cancer treatment or your supportive care medicines. So it's just really important to have an open dialogue with your oncologist and your care team if you want to start any vitamins or supplements so they can review them and provide some guidance. So as you're getting ready for your first treatment session, there's no doubt this is a leap into the unknown. So it's challenging to know exactly how to prepare. Many times there will be a nurse who will provide you with education about what to expect prior to your first treatment session. If an education visit for your first treatment is not something that has been scheduled, I would encourage you to reach out to your care team, reach out to a nurse on the team, and get that information. We often will encourage people to bring a caretaker with them for the first treatment, and just to make sure that they are there not only for support, but also if you were to experience any side effects, that they are there to help you and ensure that you can get home safely as well. Nothing quite prepares you fully for this first cycle of treatment. And what's important is that, again, after you leave, if you're experiencing any side effects, certainly anything that was unexpected that maybe you didn't hear about as a potential side effect of therapy, to be reaching out to your care team. Don't wait for things to become severe or uncontrolled. Reach out right away if you're experiencing any side effects.